All right. Well, good morning, everybody. We are going to get started with today's agent development training. We took last week off because I had another call that I needed to be involved with, but kind of back at it today. I've got a lot of information that I want to go over with all of you. And I'm hopeful that at the end of today's call, we'll have a little bit of time to talk through some of the short-term insurance options that are going to be available. I know that many of you on this call are newer agents, probably primarily focused on the under 65 open enrollment season, which begins here in a couple of short weeks. Um, I will say there are some trainings that are going on over the next couple of weeks with your carrier partners that I think you should try to tune in on. I know I've signed up for one specifically with Better. The carriers are communicating those out and pushing those out, so that's nothing that's on the health markets training calendar. Just watch those incoming emails from our carriers. There is some volatility happening. Obviously, we've been talking about this for a few months, but I just wanted to bring you up to speed on what I believe to be true and what I think is happening, and hopefully help get you prepared a little bit for what's going to happen in November, December, and January. So focusing on this under 65 space, there's a couple of things going on. First of all, we are seeing significant rate increases on many of the plans. I know the state of Indiana approved an average of a 26% rate increase. And so that's causing the overall raw premiums to go up. Michigan, I don't think approved quite as high, but I think, there's a potential that your plans are going to go up in the 20% range as far as those raw premiums are concerned. So that's one issue. A second issue is that the enhanced federal subsidies that the Biden administration had passed a few years ago are scheduled to expire at the end of this year. This is one of the reasons why our government is currently shut down, is because the Republicans and the Democrats are fighting over whether or not they should continue these enhanced government subsidies for people buying their own individual health insurance. So to be determined, we don't know where that's going to land. There does seem to be an appetite on both sides of the aisle for some sort of enhanced subsidies. But at the same time, I feel like both sides have kind of dug their heels in, and the government, in my opinion, has been shut down way too long at this point. So more to come. As soon as we have more information, we'll certainly let you know. To further exacerbate the situation, we have some carriers that are pulling out. So I know up in the state of Michigan, Molina is the one carrier that I can think of off the top of my head who has just said we're pulling out for next year. I know here in Indiana, we have Aetna pulling out. I think Aetna's pulling out of every market. So if they were in pockets in Michigan, they're pulling out as well. So there are, going to be less carriers available in this individual market. We're also seeing some plan design changes. So one thing that I don't understand the full scope of it yet, but I know that Better has actually said that they are going to be getting rid of many of their bronze plans. And so it'll be interesting to understand how that works. I think what will end up happening is people will get crosswalked by the federal government into the closest plan possible. But, if somebody's in a bronze plan and the bronze plan goes away and they get transitioned to a silver plan, and that silver plan is increasing by 26 to 30%, that could be a really significant hit from a premium cost perspective. So just a lot of things going on there. I think we ought to go into this open enrollment season thinking and understanding that we're going to need to touch all of our existing clients, but also that there's going to be an enormous amount of consumers seeking guidance and counsel on what they should be doing. So for those of you that are new, this is an incredible opportunity for you to do a large land grab in a very short period of time. And we need your help in doing that. A few things that I know Health Markets is going to be focused on. Number one is live transfers. So if you haven't yet set up your live transfers, if you don't understand live transfers, if you don't have the live transfer phone numbers programmed into your phone yet, if you haven't set them up in Lead Connect, get with your sales leader, get with your trainer, reach out and let's get those set up. I will say the Medicare live transfers, if you're in the Medicare space, are going to begin to flow pretty heavily starting tomorrow. We've got a significant budget. Every year Health Market spends between 30 and $40 million in lead generation, and a large part of that is to drive live transfers. So starting tomorrow, if you're in the Medicare space, you should have your live transfers turned on if you have any bandwidth or capacity to handle new business. For those of you who are only operating or also operating in the under 65 space, I would encourage you to get your live transfers on. Those are going to begin to ramp up slowly over the next 2 weeks, with the switch being flipped on November 1st. And so a lot of leads will flow. I think last year, just to give you some perspective, during the last day of the open enrollment season, like October, December 15th, going into the new year, I think we had close to 15,000 live transfer calls come in. And for those of you who have never experienced live transfers, these are people calling in off a television ad, a radio ad, a billboard, a online, ad that they saw, and they're calling into an 800 number, and they're saying what they want to talk about. They're putting in their zip code, and then those leads can be live transferred to you as an agent. So we want to make sure that we take full advantage of those this year, especially if you're new and you've got the capacity. I would leave those open. Now, I would also say if you're not in a position to take live transfers, you need to pause them or shut them off. Because what our systems do is they look to where the open leads are, and that's where we spend money. So if you leave your leads on, your live transfers on 24 hours a day, and you're only taking leads 3 hours, you're creating artificial demand that we're going to try to fill. And so I want to make sure that if you're not taking them, shut them off. But any waking hour that you can take live transfers and you have the bandwidth and capacity to do so, I think you should do that. So a couple of things around live transfers as well while we're on that topic. There has been some questions around getting your VanillaSoft VoIP number set up to take live transfers. You guys do need to go into, I'm actually going to share my screen here just so you guys can, so I can kind of walk you through this. So when you come into the resource center here and you click on your profile up at the top, this is where, right here, my profile, top of the screen, this is where you set up the live transfer phone numbers that you want live transfers coming in through. If you scroll down here, right here is where you put in your live transfer numbers, okay? You have to put in the phone number, and then you have to click this button to verify it. And then what the system will do is it'll call that number. You have to answer the number. You have to answer that call and hit 1 to verify that that's the number you want your live transfers coming in on. So several of you have had trouble verifying or validating your VanillaSoft VoIP number through this process. What I'll tell you to try, many times I think people are cutting and pasting their phone number into this field. If it's not working for you, just delete this and manually type in your VoIP number so that there aren't any extra spaces or anything, and then try to re-verify it. Something else I learned today is that if you put your VanillaSoft VoIP number in the first phone number for live calls, and you put your cell phone in the second one, what's going to happen when you do that is whenever you're logged in to VanillaSoft and you're in the system, it'll come through your VoIP number. Once you log off of VanillaSoft and you don't have an instance of VanillaSoft open any longer, it will default to sending those live transfers to your cell phone number. So it's kind of a way to toggle on and off whether you want them coming in through your VoIP number directly into VanillaSoft, or I'm on the road and I want them all flowing to my cell phone. So you want to make sure that if you're using this particular feature of VanillaSoft in the live transfer system, that when you're done with VanillaSoft, or you're hitting the road for the afternoon to go run appointments or whatever it might be, you've got to shut down your VanillaSoft, like log out of VanillaSoft, so that those numbers then come to the secondary phone number, which should be your cell phone number. So that's one way that you can use these live transfer phone numbers, okay? Another way you can use these is to have one number set up as either your VoIP number or your cell phone number, and then have another number for an assistant or a sub agent or your sister, your mom, a kid, somebody that's going to answer those live transfers, and just capture the information so that you can call them back. We have a lot of agents who will set it up so that they're working one phone line and their assistant or even just a friend is saying, hey, I'll take live transfers, put my number in on the other line. They're answering all incoming live transfers. Hey, this is Health Markets. How can we help you? Okay, Jason is the agent here. He's on the other line. Could I take down your phone number and your name, and could we call you back in just a couple of minutes? So you're not gathering information as an unlicensed individual or anything like that, but just having somebody answer that call and capture the client's information so that the agent can then call them back in a few minutes could be another viable way to use these live transfer numbers. So I just want to make sure that we capture what we want and what we need on these live transfers. I think this is an enormous opportunity. I mean, we've never, I mean, I've been doing this for 24 years, and to have phone numbers where people are calling in live transfers looking for something, the quality of these leads improved pretty significantly during the annual enrollment, open enrollment season as well. And keep in mind, we have both Medicare and under 65 live transfers. So you want to make sure to set up two different orders if you're working both spaces, one for Medicare live transfers and one for your under 65 live transfers. It's also worth noting on these live transfers that we have two types of live transfers. We have health markets branded live transfers and third party live transfers. I would recommend using both of them as you have the bandwidth and the capacity to do so. If you had to pick one or the other, historically, the health markets branded live transfers have been a little bit higher quality than the third party ones because they're responding to a health markets ad specifically. So they're coming to us. But that doesn't mean you should disregard the third party ones. There's plenty of sales in there. Up until this point, over the last couple of weeks and months, we've been averaging just over a 20% closing ratio on the under 65 live transfers, health markets branded, and we've averaged about a 17 or 18% closing ratio on the third party under 65 live transfers. So we're pushing right around 20% average, and that's outside of the open enrollment annual enrollment season. Once we hit the enrollment seasons, I believe those numbers will probably spike up to 30, 35% or even better. You also got to keep in mind, everyone is not a deal, right? If you're closing 20%, that's one out of five, which is extremely profitable at that number. So if you're getting 20% closing ratio plus, keep doing it. You're making money. And if you have questions about how you're making money, reach out to me. I'll show you the math. Especially if you're enrolling people in health insurance and Medicare and then cross-selling into supplemental products and other products. The more product you're able to sell in a single setting, the better you're able to protect a client, but the more profitable that transaction actually becomes for you as an agent. So before I move on, are there questions about live transfers, how to set them up, how this VanillaSoft VoIP system works? I can't say I'm an expert on that yet, but I'd be happy to field questions. If anybody wants to come off of mute and ask any questions, I'm happy to answer them. I see Tony's joined us. Tony, since we've been talking VanillaSoft, I'm going to give you just a second here. You're our VanillaSoft ambassador. So I just wondered if there's any updates that we should be sharing with the team around VanillaSoft today.
No, and actually my call today got canceled with them, so I was hoping to go through a bunch of stuff with them today at 1 and they canceled it. So, I mean, nothing major. I mean, obviously there's a lot of issues that people know. They know about them. I'm getting a lot of the same questions. They're working on it. So I think they're just getting overwhelmed right now because so many people are messaging. So I would just say if you got something, send it to Silas, send it to me, you know, and we'll do the best we can. Did you want to go through anything else with VS or you want to save that for another day? I know originally you had talked about it.
Yeah, I think I don't think it'd be a bad idea if there's any piece of this that VanillaSoft that you think needs to be shared today. I would say I think things have gotten better. I know my team is spinning pretty quickly
Right.
using VanillaSoft day in and day out right now, and I feel like we've made a lot of progress. I think there's been some updates. I know that the legacy notes that came over from the old CRM are now chronological date and time stamped, which is super helpful. We are still seeing some I would say issues around active policies and sometimes duplicate active policies or no active policies. So we're continuing to screenshot those and escalate those. And I tell you guys, if you run into a situation where something's not right there, let us know. There was a little bit of an issue last week that they're digging into where it appeared that some of our existing clients were being reserved to us in the queue as a new web lead, which we don't think they were a new web lead. And so they're digging into that. I know I talked about that on our TVP call yesterday morning. Um, I did sit in on the active analytics discussion yesterday with VanillaSoft, and that was they had a power user for how he's using the active analytics inside of VanillaSoft, and that active analytics is specific to our Medicare clients. I'm going to go over it a little bit later this morning, but I know that was a good session, and there's another one this afternoon. So if you have Medicare clients, you're trying to figure out how to manage your book, and you want to use VanillaSoft to communicate with those clients, you can slice and dice your data inside of the VanillaSoft CRM using the active analytic information that's been pushed into the system. So I'd encourage, I think it's from 1 to 3 this afternoon Eastern time. If you need to better understand how Active Analytics or the VanillaSoft is engaging with that to communicate with your Medicare clients, that's worth jumping into too. What other updates do you have, Tony?
No, you nailed those two. I know they're still porting a ton of info over. So I know one of the last times I talked to Amy, she said it's going to take a while because they're still pulling client info over. They're still pulling carrier info over. So that's why we're getting some duplicates. So some of it's just, we just got to be patient with some of it. And I know people don't want to hear that. And this is what I would tell people if you're trying to use a certain part of the system, because the systems does multiple things. If you're trying to use the phone system and it's just not working well for you, just stop using the phone system. If you're trying to, use the calendar system and you're just having problems with it, just punt it. Like for instance, I'm not using the phone system. I'm not using the appointment setting. We're just putting it on the Google for now. If something's not working, just punt it until first quarter. Okay, because I think some people it's working well for, and some people it's just not for whatever reason. I don't know why it's not, but we all don't have time to try to figure those little things out because we're all just insanely busy right now. So certain things I would just say just move on, and we did all this without VanillaSoft. I mean, our old system didn't do half of what the system does. So I know we have some cool toys on it. Unfortunately, I don't know how a lot of it works because I haven't had time to dig into every little piece and part as well. But that would just be my advice. I've had a couple people that were just really frustrated over certain things. I'm just like, just move on from it because it's obviously ruining your day. It's not working. There's no point in being upset over it.
I do think some things that are working very well, real quick, and then we'll come to whoever had a question there. What some things that are working very well is number one, like we are actively communicating with our clients. We're putting in notes, we're scheduling follow-ups that are coming due. The queue of leads, like serving up the next best activity, whether it's a new lead or a follow-up that you scheduled, like that is all like, in my opinion, functioning flawlessly. We're scheduling our appointments through there. We're telling in the system whether it's a phone appointment, an in-person appointment in my office, or a Zoom appointment, and we can put in the Zoom link and everything. It's sending out the appointment reminder emails. Like we're using it for all of those things, and it's functioning. I feel very well. I think some of the things to Tony's point, some of us have different. I mean, I have a Zoom phone system that I use for my office before VanillaSoft ever even was thought of, and so I'm still using that Zoom phone system because that's what we know, and it's got the functionality that I need. I'm still using Calendly. We were on Calendly previously. I did not change how we're scheduling appointments. I'm using Calendly. I'm not using the VanillaSoft calendar yet. So it's not that I don't want to use those, but I've got these other systems working. So I just decided I had to piecemeal and figure out what I was going to actually dive into this year and what I was going to wait till, the beginning of next year to start to implement my own business. So I think Tony said that well, but there are things that are working very well too. And
Yeah, and
I
I,
want
will-
to
I will say the direct email right through there is I'm using that all the time. I love it. Because I can just go from queue to queue, send a direct email without having to go back and forth. It tells me what email I sent so I can go and look, especially I have staff. So if I send somebody an email because they're losing their plan and they call my wife and go, "Hey, I got an email from Tony. I really don't know what he was talking about, but I think I need to call him." And she has no clue why they're calling. She can go in there, she can see the email that was sent in the system. "Oh, you're losing coverage with Anthem." It says it right there in the title. Oh yeah, that's what the email is about. So before we didn't have that. She had because she didn't have access to my email very easily. So that is something I'm using for I'm emailing all my clients directly out of there. And they have a ton of email templates that are already created too, which is great as well. So something I've been getting a lot of actually real quick, and then we'll go to that question is if you don't want certain people in a household not to show up in the queue, just click that close button. There's a little square next to that individual. It says closed. If you click the spouse or the kids, they won't show up in the queue anymore. So if you're only working with like the husband for everything and the rest of the family is out of the equation, just click that close button. And then they won't be popping up and you don't have to close out 5 people after a sell. That'll make a lot of people's lives a lot easier. There's another button that says close those individuals that are closed. I would not click that button because then you can't see anybody. So personally, I would not do that. I don't think it makes sense to do that. So just be careful not to click that.
So can you clarify again what button not to click? I didn't catch
So
that.
there's a button kind of above where it says, when you click the close button, there's a button above it that says, click this button to close those closed people or have them not show up. You'll see it on there. It says click, it'll say have closed individuals not show up. So it'll kind of make them disappear. So I don't want people to forget that they're gonna be looking and going, oh, I don't know if you can pull it up real quick.
Yeah, I am. I'm trying to get to. I had another client pulled up, and then I realized I've got 40 people watching over my shoulder here, so I didn't want to commit a HIPAA violation. So I'm
Right.
going to. I pulled up mine, and we'll show it here.
Perfect.
Let me share my
Yeah, just
screen.
go to your household.
Yep. So here's my household
Perfect. So you can see the close button. See where it says hide close contacts?
right
Top
here.
right? Top right of like the white bar.
Sorry, I got too many heads. Top right of the white. Oh,
Yeah.
over here.
Just
It
above your
says,
contacts.
Okay,
Yep, right
hide
there.
closed contacts. Right.
don't
So you
click
can.
that button.
Yeah,
Yeah,
if you
don't click
click
that
that
button.
button, it'll close everybody that you have closed and you can't see them.
Right. So just close them out here if you don't want if like
Correct.
if I don't want Marley and Roman and Maeve to have any sort of communication here, I can close them out.
Yep. And they won't show up in that queue as you're working the queue.
Okay.
Something else I'm going to mention that I talked to Silas about the other day that he had issue when you're doing spreadsheets or you're looking up filters, it's only filtering the individuals that are underneath your name that you're working. So if you have several assistants, okay, and you're doing a T65 list, it's only pulling people up that are under Silas Jessup. So if Nikki's working leads and Sandra's working leads, they may have contact under them as well. Okay. As
Is
of
there
today,
a
there's
way
not one
around
way to
that?
do a filter for everybody in the system that I'm aware of when I was talking to them. That's something we're working on for next year. So if you're doing lists, you may have to do a list for every individual on your team. Because Silas was like, I'm not getting anybody pulling up, and that was because everybody got moved over under one.
Well, and what we did, just so you guys know, is I moved the ownership of all of my records over to Megan Smith, my executive assistant, so that as things came due, they would be loaded up into her queue because she was the one working my queue, right? So it made sense to do that. Well, then I came in here and started saying, okay, how many current customers do I have? And when I applied this, it said I don't have very many. Well, that means I don't have very many that I'm the owner on because I moved them all over to Megan as the owner. Now, when she runs them, we have hundreds and hundreds of I don't know thousands of that are showing up on available contacts. So if you've got ownership of your records spread across multiple people in your agency, that's where you're going to run into an issue with these routing filters pulling those up. So you gotta, if you wanted to look at all your clients, you got to put ownership under one person, and whoever's the admin in your system can actually do that. They can set up, move ownership of everybody to one person or another if you have a reason to need that or want that.
Correct. But as you're working them and resulting them, they're going to keep flipping around from person to person.
Right.
So really, to me, it doesn't make sense to do that. I mean, maybe at first, but at this point, um, it's going to be hard to have them under one person all the time.
Right. So what questions do you guys have? Somebody was asking a question and I think Tony cut him off. It wasn't me,
I
but go
did.
ahead.
I, was it Sandra?
No, I had a question about, you said that they're still like actively moving stuff over from Agent Connect or wherever. Does that mean, I mean, just because there's a contact in VanillaSoft, could they still have more information for that contact that just hasn't come over yet?
From what they were saying, yes. So if you see that data error matching that was popping up, I haven't seen it for a while, but especially last week, I noticed it several times, like for phone numbers and emails. That means that they were still moving some data over for that individual maybe, and something was not, working well in the system. And Amy's like, we will probably move data over for the next 2 or 3 months. And that's why some things aren't getting handled as quickly as possible because they're spread very thin right now. Because as once they get all the data over, because they're still moving data from the last team that came on, because we were before them. They're trying getting some of their data over. Once all the data is here, they can start working on some of these other things. But they also have to be very careful on what they can and can't do right now because they don't want to shut the system down in the middle. Like we're seeing connection issues because they're trying to do some updates and things. They don't want that to happen to us where all of a sudden things are spinning, things aren't loading, as well. So we probably won't see certain things maybe even get fixed until first quarter because of that. They don't want to crash the system.
Okay.
And I would say that across all of our systems, guys. We've got a lot of third-party platforms that we rely on now. I think it's part of having an open architecture environment where we're plugging in Connecture, we're plugging in Health Sherpa, we're plugging in VanillaSoft into our platforms. It's wonderful, but at the same time, we're kind of at their mercy. I know yesterday I got an email. I sent it out to a lot of our top agents that Connecture was moving really slow yesterday. They knew it. They had people working on it. They went through an entire system reboot yesterday, a little after 3 p.m. Eastern time. And I've heard things have gotten better, and they're working to make sure that that never happens again, is what they told us on the TVP call this morning. But we are going to run into issues with those third-party platforms. And I'll tell you, like, we don't have the ability. I mean, we can escalate it to them, but we don't have the ability for our people to go in and fix some of those things. We're relying on these outside vendors that we're paying millions of dollars to do it right. So I just want to set the stage. There's going to be issues at some point here in the next 70 days where things are going to crash and burn technology wise, and we'll need to reset and maybe take a quick breath and jump back in then. Sandra, did you have something to say?
Yeah, first of all, happy birthday, Mark Van Berkom. And
Happy
Veronica,
birthday, buddy.
yeah, it's his birthday today. And then Veronica had a question. Is anyone else having trouble getting their contacts from their Health Markets website to show up? The contact me form not transferring anywhere. I'm not exactly sure what she's referring to.
Sounds to me like she's talking about her agent marketing website. And when somebody puts their information in there, it should come over as a new lead into VanillaSoft. Um, I have not had anybody else bring that issue to the forefront, Veronica. I guess my question is, I don't know how well versed you are in VanillaSoft to be able to go find the new leads that are in there. So that would be the first possible issue. And I would refer everybody back to the VanillaSoft training videos that are on the Resource Center under the Learning Center platform, under Brainier. And it's right on the main screen of the Resource Center too. There are, I think, 55
Yeah.
recordings in there now. And you should at least go, and they're like, some of them are a minute long or 3 minutes long. They're not that long. I've gotten through, I think, almost all of them at this point. Some of them weren't pertinent to me because I wasn't using that piece of the system right now, but at least I've logged in the back of my head when I'm like, okay, when I get to that point, I know there's a video on that to go watch and recap what I'm supposed to be doing. If you've got two screens you use, throw the video up on one, throw your VanillaSoft up on the other. So Veronica, I would maybe go there first and make sure that you understand how to look up your leads inside of the system to find those incoming leads.
So I,
And then-
I did do that because I've worked several of them from the system, from VanillaSoft in the leads section. And then I had multiple people that were telling me, hey, I never got a call back. I never got a call back. And I put in about 3 or 4 myself, like test customer 1, test customer 2, and they're not showing up. So,
Okay.
so
Can
like
you
I
capture
do
some
know
sort
where
of
to find them, but
can you capture some sort of a screenshot and a detailed explanation of what's working or what's happening or not happening and send that to me?
yeah, I can also send you the ticket. They have a ticket working, but it's like
Oh,
they're not understanding. I don't know if they have an answer. And I was just curious if anyone else, but yeah, I can send you my ticket that I have
well,
with
yeah, be
what
sure.
it's going to as well.
Yeah, make sure. Yeah, for sure. If there's a ticket open, that means they've recognized that there's a problem or you've already escalated something. I would also tell you guys, like, if you're going to escalate things, it's okay if you want to go straight to field support. But if you send it through Rachel and I, we are going to log it in our internal escalation tracker and follow up on it. It also gives us line of sight into, like, Veronica, I didn't know that was an issue, but I'm on a call for 30 minutes every morning with Dan Garrison and our executive leadership team talking through these issues. So if I don't know about the issue, I can't bring it up to the executive leadership team. So I'd encourage you guys, send them through us and let us escalate them, and then we'll try to keep track of everything. On the flip side of that, if we escalate something for you and it gets resolved, we need to know that too so we can check it off of our tracker. Rachel gets a little frustrated because sometimes there's these open things and nobody's updated us on anything, and you've already resolved it, but we're still trying to fight that battle. So if something does get resolved, let us know so we can check it off too. But I think best practice on things like this moving forward would be send them through Rachel and I, copy Rachel and I, and we'll get them escalated to the right department or the right person, and then we'll try to follow up on them.
Hey, Silas.
Yes.
Quick question on the VanillaSoft. I know that Laura and I have been trying to, we did send something, but I still can't get access to our clients in VanillaSoft, even through, we did get the agency part figured out. But when I pull up a customer in the agency, it tells me that there's an error. So I did resend it yesterday, but they said they got it resolved, but it's still an issue.
In VanillaSoft or in Health Sherpa?
I'm sorry, in Health Sherpa.
In Health Sherpa.
Yes.
Okay, so you're having an agency issue with your agency inside of Health Sherpa.
Yes.
And what's the issue again?
When
Sorry, my mind is
well,
vanilla sauce, so
yeah, I'm sorry. That was my
you're
fault.
okay.
So, yeah, so in Health Sherpa, when we couldn't get access, so we finally got the agency thing hooked up so all of us sub-agents can get access. Well, then when I go to pull up a customer that is with the agency and not my customer, it's pulling up a flag saying that I can't have access. It's telling me to reintegrate, but I've already integrated with CMS. And so I sent them the error and yesterday, and they said they got it resolved, but it's still not resolved. So I
Did you
can't
send it?
get,
Did you send it to field support or to Health Sherpa?
yes.
Field support.
I think we were sending it to field support.
Okay. And I don't think we saw that one come through, so I'm not aware of that particular issue. So if you want to forward it to me, if you got a ticket number, we can get it logged on our
I do have a
territory
ticket number.
tracker.
Yeah.
And then the only other thing that I would say on that, just from my experience, is Laura might need to go into the agency tab on Health Sherpa. And next, once you guys get integrated, so what happens when a sub-agent or a licensed assistant comes into Health Sherpa in your pod or in your agency, is that there's a 4-digit code that you have to enter to tie you to the
Right.
agency. And then once you've entered that 4-digit code, Laura, as the agency owner, can go into that agency button, and there's different, it'll list out all the people in her agency. And then there's on the right-hand side, she has to check a box
Yes,
full.
she did those.
Okay,
Yep.
she should check the full book and the admin box for each person in the agency.
I
So,
believe so. Because
okay,
that's what they had told her to do. So she did that. And so they thought that they had resolved everything. But like I said, when I went back in to go and pull up another customer, it gave me that error code. So
okay,
I'll double check with Laura, but I don't think she's on the call because she's in an appointment. But I don't think I think she has everything checked, but it's
okay.
still not working. But
Well, and in a
I'll double
scenario
check with
like that, I mean, those things, like a scenario like that, is it's hard to capture enough screenshots to explain what's going on. So I will
Right.
tell you, one of the things that I often do is I'll open a Zoom session and I'll hit record and share my screen, and then I'll record a short little snippet. You could do the same
Okay.
thing in Loom, which is LOOM, but record a little snippet of you going in and trying to look around and show what it's not and explain what happens. Like a little video snippet goes a long way for an IT guy or gal trying to figure out what the hell's going on. So
Okay. Sounds good.
that might be good
Thank
too.
you.
And I'll tell
Okay.
you guys, a lot of agents are escalating things to me, but they're like, "Hey, I got this issue," and like, there's no context, there's no client name, I don't know what system you're in, I don't have screenshots, like, I don't have enough context to take it anywhere.
Gotcha.
So you got to really document. And I'm not talking to you on this, Christy, but just everybody,
Right. No, I
like,
get it.
really document it well. You know, the more information we have, the more we can get to the root of root of the issue.
Okay. Appreciate it. Thank you.
You're welcome. What else? We may not get to short-term insurance until next week on ADT, but that's okay. I can punt on part of my content for today because I did have some other things I wanted to go over. Okay, I want to make sure I sent out an email this morning that everybody has their FFM certification for 2026 done. Couple of things you need to do. Number one, you need to update it in my profile on the Resource Center. Make sure that your FFM user ID is in there and the date that you did the most recent certification is in there. That's what triggers our quoting and enrollment tools to allow you to see and quote product. I also would tell you, if you're not done with FFM, I would get it done today. Full transparency, I did mine today. So you're okay if you get it done today. But it took me about 40 minutes this morning returning. It was pretty simple. But a couple of years ago, I waited till the last minute to do it again. And what happened is it took them a couple of days and I couldn't quote right on November 1st. It was like November 2nd or 3rd before I could quote. So I just tell you, get it done now. And then I sent out a link this morning where you guys can go in and you can click on the certification list that the feds are maintaining, and you can put in your NPN number and just verify that your 2026 FFM is on there. Until it's on there, it's not going to populate into other places with the carriers and things like that. So just make sure that you get that done ASAP. Last thing I'll remind you on that is that you also we have our Google Docs AHIP and certification tracker, which is a self-service document. I sent a link out to it this morning in that email. And if you guys could just go in there and update what carriers you're appointed to sell, including FFM and AHIP, and then the Medicare carriers. That way we can keep track of agents who are maybe lagging or not getting where they need to be able to be ready to sell. You don't want to wait till the last minute on this stuff, guys, because it takes a couple days for systems to appropriately populate. Okay. I'm just looking to see. Oh, one last thing I'll mention before I jump into some Medicare thoughts. We are going to launch probably later today a Google Docs call-in for AEP for Medicare. We'll have a secondary call-in for under 65 OEP. They're pretty simple. We want you, and I'll send out instructions and things, but we just need you to keep track of your new sales. And what we're tracking is anything new, any new sales to health markets or carrier plan switches. That would count as well. And I'll send all the details and everything, but even if it's a non-commissionable enrollment that you do in Medicare, we want to count that in this tracker. And if you're moving from one carrier to another, we'll count that. If you're moving within the same carrier, so if you're just moving somebody from one Humana plan to another Humana plan, we're not going to count that because that's just changing their plan. It's not changing carriers. It's not going to look like new business in any system. So just make sure you read the instructions. They'll be pretty simple. I think once you do it once, you'll understand what to do. But we need those updated by Friday morning for what you've done for the previous 7 days. So we're going to get, I don't want to have to take every Friday morning to text and email everybody to get their numbers in. So please just like set a reminder or something so that you've got it done. We need them for sure by 10 a.m. on Friday morning, what you did the previous week. Anything that you write on Friday forward, put that into the next week. Okay, that's kind of how we're setting up these call-ins. Okay, I've got some other just random things I wanted to go through. Number one, for those of you selling Golden Rule or UH1 supplemental products, which I hope all of you are selling a bunch of it because it's an incredible product. All those UH1 GRIC products, they just launched on the UHC member portal a live chat for consumers. It's not for agents yet. We may have an agent one at some point, but it is a consumer-facing live chat. So a consumer can go log into their UH1 or GRIC member portal, and on there's actually agents in a live chat format where they can answer questions for them and things, which that might be really, really useful, with processing claims, clients getting information. I think teaching our GRIC clients, our Golden Rule clients, how to access their member portals, their UHC member portals, is really going to diminish the amount of customer service that we have to do if we teach them how to use the resources and the tools that are available to them. So, okay. So I want to move over and talk a little bit about Medicare. Many of you are in Medicare. If you're not, this is not unimportant information, but because I think it's important for everybody to kind of understand what's going on. But I did want to just take a couple of minutes and pop through a couple of slides that I had put together around kind of what's going on for AEP and OEP. I wanted to remind you of the deadlines on things. Obviously, tomorrow, the 15th of October, we begin the annual enrollment period, and we can start submitting applications. One cautionary statement, I sent this out to everybody this morning. Please don't submit more than 12 applications for any one carrier in a 24-hour time frame. I think that would be very difficult to do, but if you do that, carriers are actually flagging things and saying you're probably not doing something right if you're submitting more than 12 applications in a 24-hour period with one insurance company. So you're going to get flagged, you're going to get audited if that happens. I know all of you are doing things 100% above board, and I know you're completely compliant, but you don't want to invite an audit. It's like raising your hand for an IRS audit. You don't want to do it, okay? So that's one thing to consider here. We've got then from 10/15 to 12/7, which is the annual enrollment period, and this is when we can change people's Medicare products. We can move them from Medicare Advantage to Medicare Advantage. We can enroll them in new standalone prescription drug plans for a January 1st effective date. Keep in mind, in the back of your mind, you also have what's called the open enrollment period to get things cleaned up. The open enrollment period goes from January 1st, 2026 to the end of March. It's that first quarter. And during that time frame, everybody can make a one-time plan change to their Medicare Advantage plan. It doesn't have anything to do with standalone prescription drug plans, but it's Medicare Advantage plan to Medicare Advantage plan. People can make a one-time adjustment. So what I've been telling my clients is a couple of things. Number one, if you don't want to jack around with this during the fourth quarter because you're busy or you're traveling or things like that, we can meet in January or February, reevaluate your Medicare Advantage plan, and switch you to a different one if it seems, necessary to do so. So that's kind of one thing. I'll say the only clients who don't have that luxury are clients who are experiencing a plan exit or a service area reduction, that we call them SARs, SAR, service area reduction. And we have some of those where carriers are pulling products from specific geographies and markets. If your client is being canceled at the end of the year, they have through December 31st to get enrolled in a new plan. They don't have the same 12/7 deadline if their plan is canceling. Those clients that are getting canceled also have a guaranteed issue opportunity to go from a Medicare Advantage plan to a Medicare supplement plan with no medical underwriting. Now, I don't think a lot of that will happen because most of these Medicare Advantage clients are used to paying maybe $0. And to go to a Medicare supplement plan, it might cost them $200, $250 a month between their supplement and their prescription drug plan. So I doubt if many people will make that move, but it is an option for somebody who really wants to. And you have until the end of the year, till 12/31, to get those enrollments done for a January 1st effective date because they technically had a loss of coverage, right? We're not using the annual enrollment period anymore. We're using a special enrollment period because of their loss of coverage. The other way you might use this open enrollment period is if somebody gets into January and they realize, oh crap, I have a doctor that's not in network, or my medications aren't covered like I thought they would be. We can make a plan adjustment for them in January or February or March, and it would become effective the first day of the next month. So that's important to understand as well. So I wanted to make sure we were clear on all of these dates. Some things that I'm communicating to my clients as I'm talking to them is number one, we put you into your current plan for a reason. If it's not exiting, it's probably a good option for you moving forward. And if you want to keep your plan, no action is required. It will roll over as long as it's not being canceled. So I think that's something to communicate well to all of your clients. The other thing that I just wanted to remind people of is that there is a tremendous amount of pressure on Medicare this year, more so than ever before. I've done this for 24 years now. I've been in the Medicare space for, 15 years, probably, maybe 16 years. And I've never seen this kind of chaos and volatility. But it's because there's a tremendous amount of pressure happening right now inside of the Medicare system. And so these are some of the things that I think you should have as talking points as you're speaking to your clients about the changes and the volatility and the chaos that's occurring. Number one, the government is mandating that insurance carriers cover more. Most of this is around the cost of prescription drug plans. So I think a lot of you understand this, but 2025 was the first year where the government mandated that insurance companies had to cap a consumer's out-of-pocket drug cost at $2,000 per year. This year, 2026, it goes up to $2,100. But that is a significant enhancement to prescription drug coverage under Medicare. And what's happening is a large portion of this cost is being shifted to the carriers. And so the carriers are trying to figure out, how are we going to respond to that? Some carriers are raising premiums. Some are narrowing formularies. Some are changing the copays or coinsurance on the different tier levels. Some are pulling out of the market entirely. A prime example of that is Anthem Blue Cross and Blue Shield in Indiana. They're canceling all their standalone prescription drug plans. So there is a lot happening around this government mandating that insurance carriers cover more. There will be an inverse reaction, whether it's raised premiums, higher copays, something will happen because there's only so much money in the system. It's also worth remembering that there's over 10,000 people a day who are turning 65 right now. They say over the next 6 years, that's going to double to over 20,000 people a day. So that many people coming into the system puts strain on the system. There are legislative changes and star rating changes that are impacting the profitability of carriers. I don't know if you guys understand exactly how this works, but under Medicare, every single carrier and every single plan gets a star rating, and it's 0 to 5 stars. It's a 52-point rating system that the government uses to evaluate these star ratings. We have no 5-star plans. I know in Northern Indiana, and I don't think we do in Western Michigan either. But if a carrier gets to a 5-star rating, they get the highest possible reimbursement from the government for every member that they have on that plan. So these carriers are incentivized to get their star ratings higher and higher. Well, this year, the federal government lowered star ratings pretty much across the board, which meant that the government would pay less money to the insurance companies if they had lower star ratings. Interestingly enough, United Healthcare and Humana both sued the federal government over their star ratings. Weirdly, United Healthcare won and Humana lost. So these realities are having an impact on carriers' profitability. And if their star ratings are lower, they're going to get paid less, which means they can't provide as rich of benefits inside of their Medicare Advantage plans. This is also leading to some carriers this year saying, we came up with product in early 2025 that we thought we wanted to sell in 2026, but we no longer want to sell that product. We literally have product on the shelf that we don't want to sell. And so we are seeing carriers now coming in and suppressing commissions, suppressing enrollment and quoting opportunities. Some carriers are pulling things out of Connecture and Sunfire and other third-party platforms. Some carriers are saying you can only quote this on Medicare.gov or on Medicare.gov on our website and enroll people. Some companies are saying, if you want to apply for that plan, you have to do a paper application and actually fax it in. We're not going to accept electronic enrollments in any form. So there's a lot of things happening inside of that. Last two things I'll mention here around this pressure on Medicare. If you guys haven't paid attention, 4 of the largest insurance companies in the nation are currently under DOJ investigations. The Trump administration is actively trying to root out fraud, waste, and abuse, which I think is a good thing. There's an enormous amount of fraud, waste, and abuse inside of the Medicare system, and it's costing everybody a lot of money. But when the DOJ comes in and starts investigating things, not only carriers, but medical providers are actually under these DOJ investigations. So we're seeing provider groups, being investigated for alleged healthcare fraud schemes, false billing, kickbacks, fraudulent claims. There was a large group, I think down in Florida, a couple of months ago, they were fined tens of millions of dollars and there were people serving jail time for what they were doing. We're also seeing this run rampant in the rehab, and I'm talking drug rehab side of things. I would tell you guys, I'm going to share, I've got an article that I'll share, but a lot of these drug rehab facilities are actually moving people across the country and then partnering with brokers to get them enrolled in an ACA or a Medicare plan based on their move, which is not technically a move because, according to federal law, because they're moving for medical purposes, but they're getting them into these rehab facilities and then milking the government, milking the insurance carriers for massive amounts of money for drug rehab. So if you get a drug rehab facility that contacts you or wants you to help with enrolling members and things, be very, very cautious. There's a ton of investigations going on around this, and I've got a great article that I'll share with you on that as well. So there's just a tremendous amount of pressure and a tremendous amount of volatility going on inside of the system. And so I wanted to make sure you guys kind of at least had some talking points and some level of understanding of why this is all happening. Because of this, we're seeing some premiums go up. We're seeing maximum out of pockets go up. We're seeing copays go up. We're seeing tier 3 copays go from fixed copays to co-insurance on many plans. We're seeing vision and dental and over-the-counter benefits stripped away or changed in some way. There's just a lot of movement inside of this Medicare space for this next year, in addition to the volatility that we're seeing in the under 65 space. I will mention a couple things on the Medicare side. Humana did announce last week that they are going non-commissionable on all of their standalone prescription drug plans, but not until we believe it's November 11th. So if you have standalone prescription drug clients that you need to move to Humana, I would do it in the next week or 2 or 3, because after November 9th, they're no longer paying new commissions on those products. We have seen all of our carriers across the board say that while we may not pay new commissions on certain products, we are going to continue to pay renewal commissions on all products. The only carrier that went against that was WellCare. And WellCare did that a year and a half ago, where they said we're no longer going to pay commissions or renewals on our standalone prescription drug plans. They're the only carrier that has gone to that length, though. I do think in all of this, guys, and I've had a lot of questions and a lot of conversations around, there is tremendous chaos and volatility right now. I think it's going to drive some of our would-be competitors out of the business, especially call centers, because call centers don't have the ability, and they're our number one competitor, candidly, but call centers don't have the ability to do the follow-up and develop the relationships and help guide these consumers like we do. And the lifetime value of a new sale for them is much lower than the lifetime value of a new sale for us, because we take care of them and we help them and we give them the guidance and counsel that they're seeking. I would encourage all of you, it's going to be crazy, but I think we're going to get through this. We're going to work really, really hard. but what an enormous opportunity, especially for those of you that are new and getting things rolling. I believe that this opportunity is as big as it's ever been and probably growing because I do think some of this volatility, some brokers won't be able to handle it and they'll get out of the business, which is okay because that's just more opportunity for us. You start thinking about that about a third in between Medicare and the ACA, there's about 24 million people in the ACA right now, and there's pushing like 70 or 75 million in Medicare. So we're talking about 100 million people, which is about a third of the US population that are squarely in the markets that we serve. And this is what they have to do and figure out and navigate, right? So we are positioned tremendously well to kind of look at all this and take advantage of this. The last thing I want to do today is I want to take a quick minute and just show you guys something that we're doing some training on, but I feel like there hasn't been incredible training on. Sorry, let me get out of this. And it's specifically around what's called the Active Analytics platform. Now, I know we've done a few trainings. There's another one this afternoon. But if you're selling Medicare, I just want to show you a couple of quick things. And this will be kind of interesting to look at. So if you come down on the main screen of the Resource Center, right here is your Medicare Active Analytics. You see this right here? This is the one that we need to use. And if you have done enrollments, oh, that's great. It booted me out, apparently.
Just go
Hopefully.
just go back to it. It'll let you in. Now you got to find it.
All my screens.
Yeah.
There we go. So this is kind of crazy to look at. You guys are seeing a glimpse of something that I doubt very few people in the country have seen. So I'll tell you, when I first logged into Active Analytics, I about threw up. I really did. Like I almost became physically ill
Oh
because
my God.
I started to scroll through this first page, and these were my inside feeds. 14,000 discontinued plans, 50,000 non-commissionable plans. I mean, some of these numbers were just, I've got 335,000 people. And so what I began to realize as I looked at this is the front page and the breakdown for the entire country. I don't think you guys see all of this, but being in the TVP role that I'm in, apparently I do. So, but the most important things I think you've got to look at are your critical ones. And to me, the discontinued plans is probably the most important. And so if you click on this and drill down into it, there's a ton of great information. Now, I will tell you, all this information has also been loaded into VanillaSoft, where you can sort and slice and dice your clients and the data to be able to identify pockets of individuals who need certain communication sent out to them. So that's kind of what the Active Analytics call was about yesterday afternoon and is about today. If we come down through here, though, you can see we've got a couple of agents that are within our territory who are showing up on the first page of this. Steve Cavajola, he's number 2 in the nation, but number 2 in the pure volume of clients that he has being canceled next year. So I don't know if this is something you want to be number 2 in, but he's got 229. If we look at Derek Mabry, he's got 139. Laura's got 124. Obviously, these agents have written a lot of business and have a tremendous amount of clients, but they also have a tremendous amount of clients and products that are going away for next year. So
Yeah.
I'm going to drill down into this though and show you guys actually.
Yeah, because they can actually download an Excel spreadsheet of those specific clients.
Correct. That's exactly right. So if you guys come down into here, sorry, you need to check this, and then tab off of it. I don't know why that didn't. Let me refresh this. But what you guys can actually do in this Active Analytics is you can drill down specifically to your clients and it'll show you exactly who's being terminated. I'm going to come in here and I'm going to unselect and then I'm going to come down. I think you can search it, but it wasn't working properly. So I'm just going to scroll down very quickly to HI. Where am I at? There I am. That's weird, Sandra. You and I are right next to each other in this. So if I look at that, I actually have 27 members that are impacted. And if I scroll down, I can see what they're impacted by. 2 PDP clients and 25 MAPD plans. If I scroll down even further, I can start seeing what's going on and what carriers they are with, what states they are in. Mine are in Florida and in Indiana. And then if I scroll down even deeper, it tells me exactly what carriers and plans are being terminated. It gives me some communication ideas as far as outreach that I could do directly to them and the verbiage that I can use. And then it gives me a list of exactly who all of these people are here down at the bottom that I need to reach out to. So this is probably the most important one, is the one where you're having terminated clients. But you guys can download that. You can use it however you'd like. Obviously, all of this data has been pushed over into VanillaSoft, so you can use the VanillaSoft system to slice and dice your data and send communications from there, because it's all loaded over there under MedImpact, I think it's called. And that's what this afternoon session is going to be going over, is how do you manipulate all this data in VanillaSoft to send the communications you want to send. But if you just want to know who are my problem children, I've got 27 of them. They're my number one priority, because if I do nothing, they're not going to have a plan January 1st. But I also have until December 31st to get these people taken care of. And I think we've got almost all of them already booked into appointments. We're going to do a good analysis for them. We're going to put them into a new product and then cross-sell where appropriate. So I wanted to make sure you guys knew that this was in here. And as you go back down into it and you can back out, there's all those different boxes that you can drill into. You can actually see clients in there who have a drug formulary issue. So one of the things that I was looking at yesterday is these, this is drug formulary impact. If I click on this, there's a lot of data in here.
Yeah, like next year, WellCare, that value script PDP is not going to be covering inhalers.
So if I click on myself here, I actually have 10 that are significantly impacted. And if I come down here, it tells me which carriers. It tells me exactly what drugs are the problem children on some of these.
Mhm.
And most of them are brand name. And then I can see exactly who's on what. And if I scroll over here, it actually, I'm sorry, not if I scroll over, if I put my cursor over it, I can actually see, whoop, let me do that. It tells me which one, that low impact you can see on the right hand side there, tells me for this particular client, what drug is the problem child. So there's tremendous data. This one, this particular individual's on this Invokana. I think that's one of those cancer drugs, isn't it? That's really, really expensive. And so obviously something happened where it's getting moved to a different tier level or something on their plan that they're on. So it allows me to really dive in and see what's going on with my clients. Now, all of this information in Active Analytics is based on the information that you have in the Connecture platform. So if you had members that you enrolled in a plan 4 or 5 years ago, they may not be in Connecture. They may be in there if you've worked with them since then. But if you enrolled them 4 or 5 years ago and you haven't talked to them or touched them since, that data is not going to be in Connecture, right? We've only been using Connecture for 3 years. So it's all the people you've touched and enrolled and done things with the last 3 years. You've loaded medications in. That's the data set that the Active Analytics is pulling off of. So I'm kind of using this and saying, okay, if that client's impacted because that plan's discontinuing, I'm kind of thinking, okay, are there clients who I have on that plan that I didn't enroll them through Connecture, I enrolled them through some other means, and make sure that I reach out to them. So that's where I'm using my carrier books of business to kind of compare and contrast and make sure that nobody slips through the cracks. So the amount of data, guys, we have this annual enrollment season is like we've never seen before. A lot of it's the Active Analytics. A lot of it's, the connection with VanillaSoft. It's actually pretty cool, but you got to like dive into it and spend some time studying the data to be able to know who your problem children are and what you've got to get done before the season is over. So I know we're at the top of the hour and I feel like I've covered a ton today. I'm sorry for dumping all this on you, but I felt like it was information that you needed to have, especially the day before AEP begins. So before we wrap things up, are there any one-off questions that I can answer here?
Sales, this Kevin. I have a question about VanillaSoft. It's a great tool. It doesn't say exactly what plan my clients have. Say within Blue Cross, they're not saying it's a prime value or essential or whatever. It just says Medicare Advantage prescription drug. I get that. That's not helpful. Can we get because what that does is it requires me to go back to the carrier, pull up the carrier current page, see what they have, then proceed when they should be pulling that data over. So can we get a separate field that says plan name, that actually has the plan name?
Not in 2025. Sorry, it's not going to happen by the end of the year. I've given them feedback, and they're continuing to work on the integrity of the data and the active policies that are inside of the CRM. I've been actually asking for more information around that too, and even on like supplementals, what benefit levels of supplementals they have and things. So that is all on the roadmap, but they're not making massive changes here like in the next, and that would be a massive project and something they're working on, but I wouldn't expect that now, Kevin. That's why I'd sent out an email a couple of days ago, just explaining to people how to pull your books of business. What I've done is I pulled all my books of business from the carriers and I've got them in one spreadsheet by tab. So it's easily accessible to me. So I can go jump into those. I can hit Control F and I can search for a client and see exactly the details of what they're on from those carrier books of business. So I found that to be the appropriate workaround for now. Good idea. Great. I totally agree with you that we need to have that, but I don't want to sugarcoat it and tell you it's going to happen in the next 48 hours because it's not. What other questions? I'll tell you guys from a data perspective, we got to run with what we have right now. Like we don't starts tomorrow, right? So let's run with what we got. We've got more data and more analytics than we've ever had. And I would also encourage all of you, if you're doing Medicare, any enrollment you can enroll through Connecture, please use Connecture. There's so many upsides to that. That data will then be loaded into your active analytics for next annual enrollment period. And anything that you do through Connecture should be feeding back into VanillaSoft as an application. The other thing that I don't know, and Kevin, I'll tell you this might put a little more context around it. Some of the older data that we have in VanillaSoft came from carrier commission statements. So as carriers paid us, they told us what product they were paying us on. If the carrier didn't fully define exactly which PDP plan your client was on, they just said they were on a Blue Cross Blue Shield of Michigan PDP plan and paid us. That's what we loaded in. If you hadn't done that enrollment through Connecture, we wouldn't have line of sight into that data with the current data feeds we've got coming in. One of the big migrations that we're making right now is we're starting to pull stuff into the CRM based on the books of business and not on the carrier feeds that are coming from the carriers. But we've got over 300 different insurance companies that we actually pay commissions for and try to manage this data onto, and every one of them has a slightly different process or a slightly different way to get that book of business data. So we're working through that, and it's better than it's ever been, but it's not perfect yet for certain.
Silas, that information is available on Jarvis. If you do a Medicare eligibility search, the plan will show up in that. It won't show up as a plan name, but it'll show as an H7416-008, whatever, so you can find it in Jarvis.
Yeah. The other thing I'll mention on Jarvis or Connecture?
On Jarvis.
Okay. So if you guys go into Connecture, and I'll mention this is new as well. When you go into Connecture and you've got a new client, and on that main profile screen, you put in their Medicare ID number and their Medicare information, it now pulls up what plan they're enrolled in green. So if your member doesn't know or you don't know which plan they're enrolled in, it's actually pulling from Medicare, but you put in their information there. And I've had a number of them. I haven't seen any, hasn't been able to pull that data for, but that tells you what plan they're actually enrolled in on the main screen of the main profile on the Connecture platform. So that's another way you can access data. And that's very new. So anything else before we wrap up this morning?
Silas, can you comment on Molina and whether or not they're still participating in Medicare and some of the changes? Because I have a client very interested in Molina.
Yeah, honestly, I would probably defer to Gary on Molina and what's going on up there. I know Molina's pulling out of the ACA. They're no longer going to offer under 65 health insurance plans, but I don't have a good line of sight into exactly what they're doing in the Medicare space, and I don't have clients up there impacted by it, so I'm sorry. I would lean on your sales leader for that, Kate.
Okay, thanks.
Silas, I do Molina in Michigan. ACA only is exiting, DSNP only in Michigan for Molina.
For
So there's
Molina.
non-DSNP.
Okay, so Medicare, they're fine, similar to last year. I mean, no changes with Medicare as
No
far as
changes.
Molina.
They only do DSNP. That's it.
Oh, they only do
plans.
DSNP. Okay.
I don't know if are you certain that's statewide, Kevin?
Well, it is certainly West Michigan for sure. I can't speak for the Detroit area.
Okay. Okay.
Yeah.
Thank you.
I'd verify with Gary though, Kate.
Yeah. Okay. Thanks, guys.
You're welcome. All right, friends. Well, good luck. First day of AEP tomorrow for those of you in that game. The rest of you start working towards what's going to happen here in 2 weeks. It's about to get crazy. So I'm excited about where we're at and where we're positioned. Hopefully, you all have a great week. If you need something, escalate things through via email. I think that's the best way to do it, and we'll do our best to get them escalated to get back to you as quickly as we can. Good luck and good selling, everybody. Take care. See ya.